Borla, Executive Director and Trustee of the Roundhouse Foundation in Sisters, Oregon. Aging and elder care in rural and remote places comes up a lot for us here at Roundhouse, because we know there are so many folks who want to age in place but live far away from the care they need. That can present challenges for their health, their happiness, and the social fabric of their communities. Dr. Jordan Lewis is the director for the Center on Aging at the University of Hawaii at Manoa, with the Thompson School of Social Work and Public Health. He's Alaska Native on his mother's side and got his PhD in community psychology from the University of Alaska Fairbanks. Since then, he's had quite the career. He spent time in D.C. learning about the intersection of social work and policy. He was a Fulbright scholar. He did his postdoc at the University of Washington School of Medicine and taught in the School of Social Work there. And over the course of his career, Jordan has been drawn to the study of elder care, especially in rural and American Indian Alaska Native communities. He says he wants to study the ways in which people can age how they wish, and what we can all learn from the elders who are navigating that chapter of life.
Yeah, so I guess it would, there's some themes across rural America, I'd say, just in general, with older adults, the challenges of access to healthcare, specifically specialized healthcare. There's great clinics in rural America. They're doing incredible things. They're kind of the, everything for everyone for some places. But the access for specialized care, as elder adults, you may need orthopedics or specific things as you get older that you may have to go to a big city for, and so that's a challenge we're seeing. Is if you want to age in where you grew up in rural America, which they should be able to, how do we get those resources to them? The other big challenge we're seeing is outmigration of younger generations. We also see outmigration of older adults too, where it's not just young people anymore, but that leaves a challenge. Do the older adults follow their family to an urban setting to stay near their grandkids, to have that support system, or do they stay back where they are in their rural area and try to make it as long as they can? Some can. It's not to say that everyone can't, but that's a challenge we hear elders talk about all the time. Like, sometimes it's cost. Like, some rural areas, it's really costly to live there. So can you afford to live there on your own if you don't have family supports? Climate change is a huge hot topic. Maybe, this administration, maybe it's not the topic to talk about, but we're seeing, climate preparedness. Are people ready for disaster preparedness, climate change, whether it's in Alaska, whether it's these more tornadoes and flooding and things happening that as an older adult, you can't react as quickly, or maybe you don't have a way to get out of your house or the care facility and what happens there. And I just don't think, we're having conversations here and with my colleagues that there's more older adults in the world now than younger people. And so the workforce development issues of how are we going to care for this population? Yes, they're living longer. Some are living healthier, but also living longer and not healthy. And with that comes a need for people who are trained to work with older adults in different capacities. We have policymakers and tribal leaders in Alaska and across Indian country who say, well, eventually we're just all going to be able to age in place in your own home. That would be ideal, but maybe not possible. I don't think it is. I think some people, regardless of their situation, wishes to be at home. Specialized care is what you need.
Right. Well, and a lot of your research is around tribal and indigenous communities, Alaska Native communities specifically. What does that look like? How does that differ from Western culture when we talk about aging and aging support services?
Yeah, I think the big difference is in indigenous communities, I think there's still a strong sense of looking out for each other. There's that natural support network. People hopefully know who's in the community. I'd say most communities do. They stay connected with people. They follow up. A lot of them have really strong elder support programs. So there's a lot of programs and services, whether it's providing meals at the school every day for them, elder-centered programs and services. There's probably an elder center that's more focused on social engagement activities or just gatherings. There's a strong sense within families that we take care of our own, regardless of the disease they may have, whether it's dementia, cancer, that we still take care of each other, which I think, I would say this is not across all Western cultures, but that's much more individualized. We have families who live very far apart. Maybe, the first reaction for some families is, as older adults get older, care facilities is the first thought that comes to mind. Whereas in a Native community, like, we've heard families that retrofit their homes so their loved one can stay and be comfortable. So they'll change their environment, their situation to accommodate for people who need more advanced or specialized care. Not to say that doesn't happen in families who are non-native, but I think it's more common that that's, and we are also hearing, I think, along the same lines, right? We hear elders say, "Oh, I don't want to be a burden, so I'm not gonna stay with my daughter. I'm not going to stay with my son." And so and that's even happening more in native communities as this generation of people who are growing older now grow older and are more accustomed to, maybe they went to college or they've, more acculturated, I guess. They also have this mentality of, "Oh, I'm just going to put myself in a care facility. My daughter has 2 kids. She has a job. I don't want to be a burden to her." So even that mindset is shifting a little bit, which I'd say is good and bad. And I think, we have families that fight that. But I think that's the big difference is Indigenous communities support each other. They look out for each other, and they'll make changes in their environment to support people. And then more individualistic Western focus is, you're on your own, or, we're doing our own thing. Yeah.
Well, and on the counter side of that, what does success mean in the aging process?
Yeah. So in our research, successful aging, there's 6 things that elders across Alaska say are important to have in their lives if they want to age well. Family and community engagement is really important. Spiritual presence, which could be more traditional spirituality to Western religion. Emotional or mental health or mental well-being is another one. So that's, not taking something that alters the mind. Remembering that words have power, so thinking through what you're going to say to someone else. Physical health is also important, but they, unlike more Western notions of successful aging, where physical health is the most important thing in your life, elders in Alaska say, as long as I have these other things in my life, my physical health isn't the priority. I could, we had elders who had advanced stages of cancer, amputations, they were homebound, but because they had these other 5 elements in their life, because even though they had poor health conditions, they still saw themselves as aging well. The other one was being able to engage in your native way of life. So whether that's, just having someone bring you native foods, or being able to go out and harvest your own native foods, participate in native activities are important to you. And then the last one is this idea of generativity. And generativity is Erik Erikson's idea that as we grow older, we have this desire to share the knowledge we've learned over our lifetime with the goal of improving future generations. So those 6 things elders say are important to have in their lives, and that's what enables them to age well.
I think that's such an interesting and important. We talk about intergenerational work a lot in our work here at the foundation, and I think that's a really important piece of like what is it that we get to give back as we get older. It's such an interesting component that is one of the 6 signs of successfully aging is that you do get to give back.
Yeah, I think, and as we've analyzed our data more, and as we've continued and had more research team members kind of look at our data from different perspectives, we're coming to the conclusion. I think generativity is the probably the of those 6 the most important. If we don't provide outlets for elders to share their knowledge, even other research has shown that it has a negative impact on your physical and mental health. And, I think there's a difference between growing older and becoming an elder. And this idea of the capital E elder is something that's bestowed upon you by your community, your family, and it's not something that's given to you. And I think it's because they embody these 6 things that they say are important. So when we talk to them about, what does successful aging mean to you, or is now we changed it to aging in a good way, because our elders, they're like, well, successful aging compared to what? So aging in a good way is kind of like you're more like it's like a process, right? Or something you do every day. You consciously think about, your emotional well-being, your physical well-being, all these things that are so important. But I think, they step into this role and they're seen and they're revered as an elder because they share their knowledge. And I think that's, there's an interesting podcast that I just heard a few weeks ago that we can be intelligent as older adults, but also we become wise when that intelligence and knowledge is shared without expectations for something back. And so I think that's that our elders also have wisdom. I think
Yeah.
that's what other people see in them, that they give them that title or recognition.
No, I think that that's really great. And I love that that's one of the most important factors. In some of your research, you've talked about aging and sobriety. Talk about that work that you're looking at and studying. Particularly, I know across Native communities, we can sometimes see higher rates of substance use. How does that impact the aging population?
Yeah. So when I was developing this idea of indigenous cultural generativity several years ago with a mentor, we had our successfully in data set, but then there's also the People Awakening data, which came out of UAF back in the early 2000s, which is a large statewide study on reasons for sobriety, so a more strength based perspective. And then I did some work with homeless older adults in Seattle, again, seeing if these ideas of successful aging applied also to other populations. So I wasn't just looking at healthy elders in Alaska.
Hmm.
But within the recovery data, again, we saw very similar things. And when older adults were talking about their journey in recovery, they start off with whether it's stopping naturally, so not going to treatment program. A lot of, I would say most of the older adults in that data set, and then people we've talked to since then about alcohol related research, unlike Western literature, I think, where mostly, it's more common for people to stop drinking for negative things, whether it's a DUI, hitting something, crashing your car. For the native population we worked with, they stopped drinking either because they realize they need to, because they're not going to be able to fulfill this role of being an elder. They're not going to be able to be a grandparent. They won't be on tribal council, or there's something positive in their life that they want to be sober for. For example, having the birth of a grandchild, or they're getting offered a new job, or they get to do something that they really wanted to do. And to do that, you have to be sober. So their current lifestyle, it doesn't align with their cultural values of what they want to do. And it's best explained to me as, before they get to that stage, that they talk about, I need to regain what alcohol took away, whether that's, being able to do beading, or go to a potlatch, or participate in your native games, or, eat your native foods, or do things that are important in your native community. You aren't asked to do those things if you're actively using. So if you can stop. So how they usually stop, if they don't stop naturally, then they start off with, they could go to AA on their own. They do their own studying, but then over time they start realizing that, yeah, that was a good start. It gave them the tools they need to stop. But then they start replacing AA with these cultural activities that were so important to them. And over time, those activities then start replacing the drinking behavior, to the point where then that becomes common again, and they regain and are able to step back into the role of what they wanted. And to them, that's much more powerful and meaningful to them than when the drinking was. And so thinking about that, generativity, it's more referred to in the alcohol research as redemptive narratives. And so within redemptive narratives, what your elders share these stories of, when I was drinking, this happened, and, negative things have happened, or things that they are wish didn't happen. But over time, those experiences, whether most likely negative, turn into lessons for them. And they'll say, this happened to me. Over time, I processed it, and I learned this is what came out of that experience. I'm sharing that with you, whether it's a young person, someone else in the same age cohort, with the goal of really hoping to help them not have the same experience. So they're being generative in their recovery, or using these redemptive narratives to help other people have, maybe not have a more as a difficult experience as they have. And having that outlet is so important to them.
Yeah. So this show is a lot about philanthropy. We focus on
Mhm.
how we can get private funds to whether it's research institutions like yours studying some of these issues, or it's folks on the ground actually applying this work. What are some of the things? Are there specific funding areas that you think folks should know about aging adults or elders, particularly in rural and native communities?
I don't know if it's tied for first, but I would say first, intergenerational connections, social engagement is pretty high up there. I'd say that's, we're looking at, trying to think about, there's different foundations focused on social isolation. They're trying to figure out what are some solutions to bring generations together, whether it's across the same age cohort, or, older adults and younger people. But tied with that, though, I think is, just creating programs and funding to send to communities to create like a very basic awareness of Alzheimer's and dementia. I think that's
Mm.
a growing concern across. I don't think it has a geographic, fixed
Yeah.
area. It's everywhere, whether you're extremely wealthy, extremely poor, live in the middle of rural America, middle of Iceland, wherever. I mean, I think
Mhm.
it's there. And so, if we could put funding towards just, I think the other aspect of that is funding towards resources and training for the family or informal caregivers, I think is a big gap that we don't have addressed either. There's families who are already doing it, but as more and more people are living longer, having dementia for 5, 10, 15 years, there's a lack of understanding and awareness of that disease progression and what can be done or can't be done, or some tools and tips to help not only just know how to manage the person with dementia, could be the unmet needs, the challenging behaviors, but also caregiver self-care, and how do you protect yourself and learn how to ask for help so you have respite. So I think that's, without that, I think if we don't have supports for our caregivers, we're going to be an even a bigger problem probably down the road. I hope, because there's studies that are showing that without adequate supports, caregivers are usually most likely pass on before the people with dementia,
Wow.
due to health conditions and the stress of the caregiving duties. So that's a huge concern, especially if you're primary caregiver in your or a rural area, or because then where does your loved one go, or do they go to a different family member? Yeah, I would say those are the top two. I think the other big one, of course, is like, how do we keep people to rural America has its own unique special gifts about it. How do we keep communities from disappearing? I think that's a that's a bigger issue, right? I think there's so many variables that go into play into how you would do that, but um
Talk more about that. Like, help me understand. Like, are you thinking of a certain population in a community or communities in general?
I think communities in general, like we every once in a while you hear about, oh, rural America, like in Alaska, for example. Oh, no one lives in the village anymore. That Do we take it off
Mhm.
the map? Do people just go there in the summer? Is it just a fish camp because they're out migrating? Or we have villages in Alaska where it's only people who are 70 and older, and there's like 20 of them. Is that still a village? Like, what's happening to these rural areas? I'm not as familiar with the lower 48 or contiguous United States and rural areas there, but I can imagine rural communities might be changing or shifting in their population
Yeah.
and what's happening. Um, but there's for the generations who are like the baby boomers now who are growing older, if they came from a rural area, there's something special about people who want to go back. We hear a lot of elders say, I went back to my village in Alaska and it's just not the same, so I can't live there anymore. It's not what I remember it when I was living there. And so what was that, and how do we bring that back? Is it because there's no young people there? There's no sense of engagement, social connection, programs and services. No, even the village I grew up in, Naknek, I go back and it's like, yeah, there's people there. People I grew up with there don't live there anymore. So it's like, yeah, it doesn't have the same feel for me anymore. So what is that feel? Does that mean in 20, 30 years when the baby boomers have passed on that rural America is going to have a different feel if it even exists anymore? I'm sure it
Wow.
will, but
Yeah. No, understood. Yeah, I think that's a really interesting point of like what do you come back to, right? And it comes back to that point of community and really finding ways to support elders and intergenerational work. So folks do have that place to come back to where they feel included. Well, and I know it's a ways off, but how do you hope that you age? What have you learned through your research that you want to apply to your own life?
yeah, I mean, that's a great question. And I think I've only been asked that question twice. I think you're the second person to ask it. And I still haven't really thought about what, I guess, living long enough to be able to share my experiences of, I think every generation says this, right? I'm in this unique generation where we grew up before computers and video games and cell phones, but we've lived long enough to see what's going to happen after. Whereas a generation now, my sister she's born in 1990, so she's always had computers in her life. But the two sons we adopted, they're always going to have cell phones and everything, fancy things in their life. So I think I look forward to talking about, and hopefully I'm asked about what life was like back then. We laugh now like, oh yeah, we grew up before we had computers, had to write everything, had typewriters.
Yeah.
Also, the native part of growing up in Alaska of like what it was like to pick berries and be on the land and know how to read the weather. And like, those are things I learned from my elders, making sure I pass that on. And it's something I think about now. So there's, I guess, having learned what I've learned from my research, there are certain things now I find myself writing down or telling my sons now so I don't forget, because I have this fear that I'm not going to remember. And I also, doing some work, doing work at reminiscence therapy, I listen to music like yacht rock and 80s music, and it brings me back to these memories. And now I put myself as an older adult, how do I make sure yacht rock's still available when in 40 years from now, 30 years, like, because it brings back such positive memories for me for some reason. And so it's like, I think about those things. The other aspect of my research, like, my parents ask these questions, like, how do I age? Like, what should I be doing? I'm like, have you not read anything I've published? Like, the funny part of it, like, oh, you should read what I've written, or,
Yeah.
there's things that we have learned that you can apply to your own life. But yeah, I think it's just making sure that the things I want my kids to remember, or I want other generations to remember, I document now, because I'm seeing in the generations and older adults now, they didn't have that opportunity to, whether they're because of dementia or they've passed on, to document stuff they thought was important.
Yeah, well, it's been so great to learn about your work, and I really appreciate your research that you're doing, particularly with American Indian Alaska Native communities. So thank you for doing the work, and thanks for sharing today.
Of course, yeah, thank you. I appreciate the opportunity.
Aging and becoming an elder with a capital E is such a privilege and a time in life that should be celebrated. And there's such an opportunity for foundations and funders to play a role in that, identifying different opportunities within community that would be super helpful for folks to be able to be connected, to learn more. There's some great national research out there around Alzheimer's and dementia. How do we ensure that those get applied in these communities? Working with organizations like dementia-friendly organizations on the ground, or providing access to education opportunities for first responders or other folks that are working in those spaces. Those are all great ways to ensure that this information and research gets applied in these communities that are further away from where it's actually happening. I love the list of things that help folks age successfully, especially the generativity, the desire to be able to share knowledge and improve future generations. Head over to fundingrural.com to read more of Jordan Lewis's research, see videos, and more. Thanks for listening.